So Robby, what's on your radar today?
Well, I'm delighted to tell you. The U.S. is in the grips of a baby formula shortage, which is not delightful at all. Abbott Nutrition, a popular manufacturer, issued recalls on 3 of its products in February after a bunch of bacterial infections and actually 2 infant deaths, very sadly. Now, many stores are out of baby formula or are placing limits on how many purchases customers can make in order to preserve their existing supplies. So one mother, Ashley Hernandez, told the New York Times that her preferred baby formula was out of stock and to get it on eBay would cost $120 for a single can. Pandemic-related supply chain issues have obviously compounded the problem. According to CNN, quote, the out-of-stock rate for baby formula hovered between 2% and 8% in the first half of 2021, but began rising sharply last July. Between November 2021 and early April 2022, the out-of-stock rate jumped to 31%. That rate increased another 9 percentage points in just 3 weeks in April, now stands at 40%. In 6 states, Iowa, South Dakota, North Dakota, Missouri, Texas, and Tennessee, more than half of baby formula completely sold out during the week beginning with April 24th. Now, half of the 50 states are massively struggling with this shortage. And importantly, Abbott Nutrition is a manufacturer of a special kind of baby formula that's needed by babies with rare health conditions. Quote, if this doesn't get fixed soon, I don't know how my son will survive, one mom, Phoebe Carter, told Politico. Her 5-year-old son has a rare immune disease and can't get the formula. She can't get the formula she needs for him. Now, we're unfortunately way behind in fixing this problem, but U.S. officials could have made such shortages less likely in the first place by approving baby formula that is widely available in Europe. But per usual, the Federal Drug Administration has other priorities, like mindlessly making it more difficult for people to buy products they want and need. And in fact, it is technically illegal to buy baby formula that is approved and perfectly safe for consumption in Europe. The FDA, of course, has a long history of taking forever, years and years and years, to approve foods and medications that European officials have already decided are fine for humans. One particularly good example is actually sunblock. There are kinds of sunblocks that have been available in Europe for long times, not approved by the FDA here. I think if it's good enough for scientists in Britain and France, it's probably good enough for us, but the FDA takes a different view. The FDA and the Centers for Disease Control and Prevention also screwed up the early approval process for COVID-19 testing, very famously, you remember that. Now, when asked about the shortages, White House Press Secretary Jen Psaki praised the FDA, actually, for taking swift action to get the compromised baby formula off the market. Let's listen.
There is growing concern about a persistent supply issue with infant baby formula.
Yeah.
There's about a 40% shortage right now. Major retailers having to limit how much people can buy, especially acute in places like Texas and Tennessee, Missouri, Iowa. This is partly an FDA issue, but it could be a Biden administration issue. I'm just wondering if you guys are planning on taking any steps to help remedy that.
Well, let me first say, as you know, but the FDA issued a recall to ensure that they are meeting their obligation to protect the health of Americans, including babies, who, of course, were receiving or taking this formula, and ensure safe products are available. That's their job. Ensuring the availability of these products is also a priority for the FDA, and they're working around the clock to address any possible shortage. So what the FDA is doing, which while they're independent, they are part of the administration, is taking a number of steps to address. That includes working with major infant formula manufacturers to ensure they're increasing production, because part of this issue is, of course, making sure there's stock on the shelves, right? And working with the industry right now to optimize their supply lines, product sizes to increase capacity, and prioritizing product lines that are of greatest need.
What on earth is she talking about? The most useful thing for the FDA to do would be to stop erecting regulatory hurdles that make it harder for poor and working parents to feed their families. This is a case where you actually can just let the market work. It's the government, the FDA, that is coming between families and food for their children. This is my frustration. I'm listening to this issue. I'm hearing just in the past couple days, I'm learning about it. Baby formula shortage. Seems that it's caused by this recall, just terrible situation. Mm-hmm. And then I'm doing more research and I'm learning that baby formula, widely available in Europe, probably safe. I don't know what you think. American scientists or the American approval process is like way more intelligent or something than European products? Probably not. Probably if British doctors think this is safe for British kids, we can just let them. Our government could say, we haven't signed off on this, but across the world, in civilized countries, they take it and they're fine. Go proceed at your own risk. That will be fine. But U.S. officials don't let us do that. And
Robby,
so we have shortages.
I was curious about the logic behind this when I looked at your radar. And so I went ahead and followed one of the links that you provided to get some explanation, some clarity on why it is that there are barriers to importing baby formula from Europe. And the reason that was given in an article by Wirecutter, one of the reasons was that European formulas were transported under they can't check the temperature conditions of the import, so that European formula shipments may be detained if detected because they don't meet FDA shipping requirements. It would also be difficult to find out whether the formulas were subject to recall in the EU. So those were two reasons. One, we don't really know, just like we're talking about this in the context of a recall, which I presume you think is a good thing, that the poisons soiled could make babies sick.
What if more kids starve and die because they can't get baby as a result of the
Robby, I think the ideal scenario.
We're in a little bit of a trolley problem here,
but ideally neither of those things happen. And what we're having is a market problem where there's not enough supply because there was a mistake at the factory that I think we're glad got cut. I think there's some questions to be asked about why they aren't able to remedy this and increase production at this point. I think that's what Jen Psaki was trying to get to. I think there's some question as to whether or not we should have better backups if there are essential goods like this in this country. I mean, we just came out of this, or we're in the process of coming out of this pandemic where we had shortages with protective gear, we've had shortages with medical gear, we've had shortages with a lot of things that were really necessary to keep the country going. And part of that is that we've outsourced a lot of this stuff overseas, and that's a conversation that I'm more than willing to agree with you on. But this one, I'm not exactly sure how limiting the FDA, which caught this outbreak that could have caused a great deal of harm to babies in the first place, is a solution to what I agree is a problem of a baby food.
The recall is causing harm as well.
But what do you want them to have done? Not recall the bacterial baby food that could cause harm to babies?
Well, I'm just asking the question, what is going to cause more harm?
I think the answer...
The FDA doesn't consider that kind of stuff.
I think the FDA does consider that kind of thing.
No, they consider how can a power-hungry, totally unwilling to let free humans make individual choices, believe all power should be constant. They are the ones who get to decide what you are allowed to buy and consume. Doesn't matter if you consent, doesn't matter if the seller consents. They are interjecting themselves into this process to say they know better than you and your stupid family, and they don't care what your kid needs.
Okay,
they know better than you.
Let's play this out, Robby. Let's play this out. Do you think that anybody should be checking to see if there are outbreaks in this baby food?
I think checking's a great idea, but...
Okay, so when they check it and they find out that there's a bacterial outbreak in the baby food, do you think, what should be the process? They alert the public and the public can choose to go ahead and buy it?
I think if a producer of food or anything, baby formula, provides you poisoned food, you should take them to court and take them for millions of dollars.
So you think that individuals should feed their babies tainted food, have the babies get sick, and then sue for damages?
What I'm mainly saying is I think you should be able to buy baby formula that's perfectly safe in Europe that the FDA says I'm not going to allow you to talk.
So I'd agree. It looks like the difference between, there are some substantive differences, this article points out, between American and European formulas, but it's not, most of them aren't health concerns. The concerns with the European formula aren't that they are not good for babies. It's that there's no regulations and there's no oversight in place right now to make sure that they're shipped to America in conditions that would preserve them as high quality, and we're not in the same situation where we're again dealing out tainted baby food.
Right.
So I agree that part of the issue might be that we need to bolster, dare I say even grow the FDA, expand its ability to do the kind of checks that would enable them to import baby food from Europe, as you're describing, whatever is required, refrigeration tanks, inspections, whatever is required, because this is a real crisis that I think you've really rightly identified. I'm just not entirely sold that the solution is, in fact,
if the FDA would allow these things to be sold, maybe there would be a profit to be made for the manufacturers in Europe, and they might create some infrastructure to sell their products here because they would be open to our markets. The FDA doesn't need to micromanage they're not very good at that. They totally screwed it, them and the CDC together totally screwed up the early testing for COVID. They said no one else can do this. We're just going to handle this. And they got it wrong. They're not logistically competent. They're cautious, and the sunblock stuff is fascinating. If you have time, you should look. It's again, perfectly safe stuff that protects people from skin cancers in Europe. They've not approved here because very cautious. I think non-libertarians don't always appreciate that, are very concerned about all the bad incentives in the private sector and are acting like, now I know you don't think that cops are angels, you don't think that our military advisors are angels, but our regulatory agencies are not all angels either. They have a lot of bad incentives. They have a lot of protecting their own. I mean, the way everyone in the government scientific community has really, rallied around a defense of gain-of-function research, for instance, of defending those kinds of things. Should make people wary about, what other insider industry stuff. They're like, no, this is just our jurisdiction, and we're not ever going to do this a different way because we don't want to give you more choices.
I'm here for an argument that the FDA should be improved.
Banned. All right, I'll keep trying. Well, next up, protesters have gathered outside of Justice Alito's home in Virginia. Let's discuss.